proceed.
There we go. Great. So thank you, Barry, for the wonderful introduction. It's fantastic that you were able to give everyone an overview of AI, because again, sort of understanding the community and the audience, it's good to have that level set. I know that many of us have heard a lot about AI as well. What I'll do today is just give one example of how AI, specifically reinforcement learning methods that Barry had talked about, can be used for disease intervention planning, starting with the use case of malaria eradication and control. But the way that we formulated this is that it can extend to other such disease intervention models, including COVID-19, which we have started to work on as well. So I'll just give you an overview. These are kind of the different activities that we focus on at IBM Research Africa. And today I'll really talk about an example in the healthcare space. And you saw this from Barry in another way. I think he had circles and mine has squares, but they say the same thing. Just kind of letting you know the context, because I know there's quite a bit of buzzwords when it comes to artificial intelligence and everyone talking about machine learning. So within machine learning, as he had supervised learning, semi-supervised, unsupervised, and reinforcement learning. So that's the focus of the example I'll give today will be in reinforcement learning, where you have an agent interacting with an environment. He talked also about where we are in terms of AI, weak and strong. So again, we're showing the same thing where we're in narrow AI, and then we're, where we want to go and where our projections are maybe by 2050. So now we've got the context. You've got to hear about AI twice super fast. And today I want to talk about one method for which AI can be used to help accelerate a malaria eradication. And really it is a super example for decision support for disease intervention planning. So I have just a couple of slides, so it won't be too long here. And afterwards, happy to answer questions. So we all might be familiar with the problem of malaria, in which we know every 30 seconds, somewhere around the world, a child will die from the disease. 90% of the cases of malaria are occurring here on the continent in sub-Saharan Africa. And then we see more than 400,000 deaths, for example, in the last report, which was in 2018. But what's important is there are ways to treat it with anti-malarial drugs, and the transmission can actually be prevented with effective control. For example, the parasite has been with us since essentially the beginning of time, and it was on all the continents except for Antarctica. But over time, different geographies, nation states have been able to implement various programs for control and eventual elimination of the disease. So it's possible. Some of the traditional methods for this type of planning for control and elimination is usually you convene different groups, you have research, just like Professor Barry mentioned, and even our previous colleagues mentioned. You're getting folks together, maybe sharing models, data, outcomes, reports, and you make a plan for a specific location. Let's say in our case, in Migori County in Western Kenya, we have a high prevalence of malaria, and you make a plan that's like a long-term plan, maybe even 5 years. You're going to use different interventions like spraying, you're going to deploy nets, you're going to make sure that you have certain supplies within your health facilities. So this usually requires multiple teams collaborating with different areas of expertise to make this plan, put it together, and make the right decision. But actually that space of decisions is actually quite vast. So these are just a couple of examples of the traditional strategies and as-is strategies. So if we look at this problem of decision support, what should we do for malaria control and eventual elimination? You have these decision-making teams, as I said, that are usually multi-stakeholder, and they have targets: reduce mortality, eradicate it, reduce the prevalence. And then they also have constraints, like in their budget or what supplies they have in the supply chain and so forth. At the same time, there are these rich models that are out there for malaria. There's actually quite a mature malaria modeling community, various consortiums and groups that are together that are building on representing the spread of this disease, even starting at the larva, at the mosquito, at the vector. And what we want to do is say, okay, there's a strong community out there. We want to leverage these existing models. We don't necessarily want to build another one. How can we leverage these existing very rich models that represent the complex dynamics of malaria, and also represent the different interventions that we can do in malaria, like you see at the bottom, to explore what set of interventions will help decision-making teams reach their target for specific geographies. So here is just an example of 4 interventions, like case management, what you should do there, spraying, larvicide, net distribution. So you can imagine that these different interventions are applied to a population by proportion. So anywhere between, let's say 1% to 99% of the population might benefit from one or more of these interventions. And it's also by location. So if you think about that, that problem is combinatorial and it's essentially infinite. So the space of all possible combinations of interventions is beyond daunting for decision makers. And at the same time, they need to be able to access and understand these intervention models. And decision makers are usually on the policy side of things. And so that might not be their background and area of expertise. So we need a way for these communities to come together, and a way for methods to help simplify or ease the consumability of the possible optimal intervention plans. So what's nice is there are methods. It's actually quite well suited for AI. So there are methods to explore this very vast intervention space of all possible choices you can do to help eliminate or reach any target with this disease. So these domain models, again, I said they were rich, they're comprehensive. You put in some input and it projects the future state of the world with respect to the disease. This tends to be quite computationally expensive, but fortunately now we do, in modern compute, we do have infrastructure that can actually run these simulations very well, including in high performance computing. As I said, the space is vast, it's complex, and AI is well suited. So if you take that original model that I showed on the previous slide, this actually can be representing an environment in which you have an agent. So this is kind of what is known as the classic reinforcement learning image. You have an agent that interacts with an environment, and an environment can be anything. So you just need to define what actions something can do, and games are the classic example of it. Actually, reinforcement learning has done extraordinarily well in the past few years. You've heard of some things by maybe DeepMind and Google, and some different games that have been shown to leverage these techniques. In our case, we don't want to use gaming. We want to use disease models or real world models, such as models that are in the disease space, but it also can extend to other types. So an agent will interact with this environment. It'll put in some inputs, like what are the types of interventions they could do in a space. The environment will simulate what will happen in a future state, and then the agent will say, have some reward signal and say, huh, this state of the world looks good or it doesn't look so good. And therefore I should or should not do this action. So the way we started with this work was on this notion of a one-step intervention plan. And really what that is saying you have a set of options in terms of interventions. In this case, we started with 2 insecticide-treated nets being deployed in a specific location and then spraying being deployed. So basically you want to know what proportion of the population should get nets and what proportion of the population or the household should be sprayed, and any combination thereof. So you basically are saying, okay, you have, this is again a huge space. You want to pull a lever and say, okay, what should I do? Should I have 10% of nets deployed and then spray 50% of the household? If I do that, what does the future state look like? So you can do this in a number of ways, where you sample lots of future state scenarios. And that's what you actually see at the top picture. So at the top picture, you're sampling lots of future state scenarios, and you're able to get some reward. So this future state looks good, this one doesn't look so good, and you get this kind of landscape of where things are good or not. In our case, we defined good as DALYs averted, that's disability adjusted life years that were averted. And so places where you would see in the landscape where we, were able to avert the disability adjusted life years would be a good thing. So you do need this cost function. That's actually an important element of it. And then our environment we used was from Open Malaria, which is actually an open source environment that other folks can use as well. And this being specific on the technique and the AI kind of language or reinforcement language, this is a notion called multi-arm bandits in some level of inference. So you can check out those. But I think what's most important here and kind of very exciting is right here in this is looking at this bottom plot. So in this lower left corner, you see 1, 2, 3 different AI algorithms or agents that explored this environment, where dark red is a good reward, okay? At that time, when we did this experiment, the current intervention between nets and spraying for a specific location in Kenya was, this is, the x-axis is net coverage, it's ITN coverage, and the y-axis is household being sprayed, IRS coverage. So the current intervention at that point was around, okay, 55% of the households should get nets for this location, and about 70% of the households should be sprayed. And that was really, and so this is this notion of research that Barry mentioned, that's really because you have these domain experts that know the model very, very well. They'll take, because it's kind of expensive to do, they'll take a few, maybe tens of samples. So in this case, it wasn't very many, and they'll run these samples on their one siloed model and get these future projections and try to pick the best. At the same time, we had an expert human basically go in and say what they thought would be the best for this location as well. And they thought that about, let's say it's 83% net coverage and 90% spraying of households. So what was interesting is that when we had access to the same environment, we developed 3 kind of variants of an agent or a reinforcement learning agent to explore the environment and look for the best intervention or set of interventions. And in this case, what this shows is that there was a part of the space that may not have been explored by sort of human experts that the AI discovered. It's not necessarily getting ground truth and knowing in the real world what would happen when you do it. That's a little bit harder, and that's on the monitoring and evaluation side. But it's showing that there is other parts of the model that actually were potentially more effective, or at least cost effective when we're thinking about tallies averted. And that opened up the option of thinking, is there a set of interventions that haven't even been tried or thought about before, and can we leverage compute and AI to find those? So that's for one-step intervention planning. But if you think about it, you know, these plans, as I had shown in the past, are usually multi-year, and they can vary. And you know, you have people in a room, and you look at the different model outputs, and you make a decision. So fortunately, there's actually methods in kind of a full-on reinforcement learning problem, which really is around this notion of sequential decision making. You know, what sequence of actions, or in this case, interventions, should be done to achieve your target over a certain time frame. And that's where you kind of get this notion of a tree. You start with the world that's now, you want to get out to year 5, and you try different interventions that are basically your branches in the world, and they simulate the future state. So you, at the end of the day, want to go down the most cost effective, or the one that has the strongest reward signal based on what your targets are, to tell you what to do. And this is actually a shift in thinking. So it means that you don't run necessarily M&E and then change after year 1 your intervention plan for a certain location. It actually can help you plan and project what the changes should be for a certain time frame, for over, let's say, 5 years, for example. You should still obviously run M&E, but in this case, we're actually planning ahead of time, and that helps with resourcing and all sorts of things for the decision-making process. Now, what we also saw is that by doing this notion of multi-steps, we saw that the multi-step, in comparison to the single-step plans, actually helped reach a specific target. So in this case, the target was to reduce the prevalence of the parasite. And let's say it's at this red line, that's your target prevalence. And then you have a restriction by budget. So as it turns out, the multi-step intervention actually much more quickly and much more cost effectively got the country or the location to their target prevalence. And this is, again, a very interesting and different, and a shift in kind of the way disease intervention planning, specifically in the malaria space, is being done. And it also gives a lot of hope and promise for what AI methods can potentially show for decision makers. And finally, one other method we wanted to explore, again, so you know, we're not necessarily epidemiologists, but we can leverage these models. So it was a way to combine multiple models. Again, the community is very rich. It has quite a bit of history. So how do we take the strengths of multiple models and potentially combine them together and represent their uncertainty in a proper way? So these are all examples from real models. And what we've done here, let's say the purple space is what's considered good, and you can see the size of it varies per model. And then we're able to apply a technique, and there's many others that can be done as well, a covariance weighted averaging that incorporates the outputs of these 3 models into one, and hence you're able to look at you know, potential trade-offs between the models and getting to your target. In this case, it was prevalence. So let me give one example of what we're actively doing now. Working with Uganda, we have a case study around how do we generate new malaria intervention programs to reduce prevalence and minimize deaths in Uganda. What's very interesting about this is Uganda has, let's say, 134 districts, right? And every district has its own different level of prevalence. And it has its own different environment factors, right? So how are we going to help Uganda, the country, reach a target of 5% or less prevalent if, you know, these districts are varying in their current states of the world. So this is, again, very well suited for AI. It's a very daunting task for a policymaker to say, what's the right policy for us to reach it as a country, and then also every single 134 districts to reach it as well. And given that kind of framework, we've done the same type of thing for COVID-19. Now, what's interesting about COVID-19 is, you know, epidemiological models are still coming out every day. There's not necessarily a de facto model or a set of models. And we're also obviously still learning about the disease, but there are methods to understand from a causal perspective, how do the different interventions or, you know, non-pharmaceutical interventions that are being implemented by countries actually impact the spread of the disease or deaths or hospitalizations and so forth. And we're all very familiar with these interventions. And again, you have these COVID-19 task forces in your businesses and universities and in governments that have specific sets of goals and the constraints that they're trying to meet in this type of scenario. So this is, I just wanted to give you an idea of how you can formulate disease intervention, a kind of planning problem in a way that AI methods, they don't really care about the disease. They know how to explore the space really well, so that you can essentially plug and play different types of models in this space. And this is the same as well for actually for other models. You can even think about climate models and so forth. So yeah, just wrapping up. We've developed all of this within a platform. We've actually released part of this to the AI community. So getting the AI and the modeling community together is also a unique thing as well. We've done that 3 times in 2019, and we hope to continue to do that type of work. I just want to acknowledge my team that we work with in the healthcare space, and that's it for me. Thank you, Barry, and folks on the line.